Okay, this is Craig. Today we're going to do a head to toe assessment, starting with the head and the face. So we're going to start off initially looking at the inspection of the face and the hair and the scalp for any color changes, any tenderness on palpation, but any bruising, any scars, any lesions, any symmetrical misalignments. We're going to feel the hair texture for distribution. We're going to look at the hair color and see if there's any abnormalities or tenderness upon palpation of the head. Next, we're going to go ahead and feel the temporal artery for temporal arteritis and see if there is any pain upon palpation. We're going to feel preauricular lymph nodes, postauricular lymph nodes, tonsillar, submandibular, submental, go back to occipital lymph nodes, anterior cervical chain, and posterior cervical chain, and supraclavicular. Okay. Next, we're going to go ahead and inspect the ears, the outer helix and the pinion tragus for any tenderness, masses or tenderness in the ear. I'm going to look in the otoscope for the tympanic membrane, if I can get it on. And we're also going to inspect both ears bilateral for the external helix, the pinion, and the tragus for any tenderness. Go ahead and look in the ear. Good. Do the same thing over here. We're going to bring the ear up and out to get a better look at the tympanic membrane. That was the ear. Now we're going to look at the eyes, the eyelashes for distribution, any color changes. We're going to have you look up to the sky for the conjunctiva, any sclera, any redness, any itching, any discharge. Next, we're going to look at the nose for our central line for symmetry. Have you take a deep breath. Good. And the same thing over here. Good job. Any problems taking a breath there?
Mm-mm.
We're going to look at the mouth, the lips, and the tongue, and the teeth. Open your mouth, say ah. Say ah. Good. Looking at the uvula, the tonsils, one more time, open real wide. Bring your tongue up to the roof of your mouth, underneath the tongue, the salivary ducts, and good. All right, so next we're going to look at the throat. We're going to feel for, look off to here, the thyroid gland. Look off to the right again. Now swallow for me. Good. Look off here to the left. Swallow again. Alright, now we're going to do the neuro exam. Neuro exam, we're going to start off doing cranial nerve 2, and we're going to start by consensual and peripheral vision. First, I want you to tell me, actually stand up, this might be easier. Face that wall over there, behind you. Step back just a little bit. Okay, I want you to tell me you can see my fingers, okay?
Mm-hmm. Yes.
Good. Keep your eyes straight.
Yes.
Perfect. Have a seat again. Now we're going to look at central line. Now I'm going to have you close one eye at a time. We're looking at the Snellen eye chart. It's obviously closer than 10 feet because we're in a room, but ideally it's at 20 feet. So close your right eye and just read the first 3 lines for me, please.
From the top.
Yeah, top and bottom.
The first line is E, second line is F and P, third line T, O, Z.
Okay, now read the 4th line with your other eye, please.
L, P, E, D.
Good. And so we would continue on the whole way with both eyes, but again, since it's at 10 feet, we're not going to continue the whole length of it. Cranial nerve 3, we're going to look at consensual and direct light reflexes. So I want you just to keep looking straight towards that same eye chart for me.
Mm-hmm.
Good. Now we're going to look at pupillary restriction. Now I'm going to look at this eye, and I'm going to watch the other pupil. Good. Awesome. Now I'm going to go ahead and have you watch my fingers. For convergence, I'm going to do cranial nerve 3 as well, and we're going to do, and 3, 4, and 6, and we're going to do extraocular movements. So I want you to watch my finger, and just follow my finger all the way up, all the way down. Don't get ahead of me. Down here, and all the way up. Good. And last one here, and here. Cranial nerve 5, we're going to go ahead and have you clench your teeth together. Good. And we're also feeling, which I went back from the previous exam on the face, is we're also going to feel the TMJ for crepitus and any misalignments in the TMJ joint as well. But now go back to the face, and we're going to go ahead and do light touch of the rest of the cranial nerves of the face. Can you feel this here? Let's actually do this with a piece of cotton. It's a little bit lighter touch. It might be a little bit easier for you. So close your eyes. Can you feel this on your forehead?
Mm-hmm.
Feel this over here,
Yes.
and over here,
Yes.
on here,
Yes.
and last time here.
Yes.
Okay, now we're going to go ahead and do cranial nerve 7, which is the facial nerve. And I want you to open up your eyes real wide, puff out your cheeks, open your mouth real wide. Everybody loves this part of the exam. Open your mouth real wide and stick your tongue straight out, please. Good, relax. Cranial nerve 8, we're actually going to check the hearing. And I'm first going to do finger rub test instead of the whisper test. Can you hear this over here and tell me when you cannot?
I can hear it. Can hear it. Can not hear it.
Okay. Same thing over here.
I can hear it. Still hear it. I can't hear it.
Okay. And then next we're going to check Weber's and Ryan's test. First we're going to do air conduction. I'm going to place it on the apex of the head. If she hears the lateralization to one ear or the other, we're going to check bone conduction on that side on the mastoid bone. Air conduction should be twice as long as bone conduction. Did the computer go off?
No.
Good. Got lost there. Where am I? Cranial nerve. Yeah, it was 8. So 9 and 10. Now I'm going to have you do open your mouth real wide. Say ah. Good. And look, using phonation to look for uvular rise in the soft palate. Now I'm going to do cranial nerve 11. Feel for bring your shoulders up. The shoulder shrug test. Muscle resistance. Relax. And the last one is cranial nerve 12. I want you to protrude your tongue outward, and I'm looking for any fasciculations. Good. Close your tongue and relax. All right, so now we're going to go ahead and do the abdomen. I want you to lay on your back for me, pretty please. With the abdomen, first we're going to start off just inspecting the abdomen. I'm going to push her up a little bit, okay?
Okay.
So first I'm going to inspect the abdomen for any bruising, scars, any lesions, discolorations, or the contour and symmetry of the abdomen. I'm also going to have you cough for me one time to look at the contour, any changes there. Next I'm going to go very gently. We're going to start off with the most light touch to the abdomen using auscultation. Listen in all 4 quadrants. Ideally be about 30 to 40 or 30 to 60 seconds per quadrant. Next I'm going to go ahead and listen for the abdominal aorta, which is 1 inch superior to the umbilicus using the bell of the stethoscope. Now 1 inch up and lateral for the renal arteries. And now 1 inch inferior and lateral for the iliac arteries. And just diagonal for the femoral arteries. Good. Now we're going to percuss each area of the abdominal for tympany, any dullness in all 4 quadrants here.
No.
No.
Nope.
And last one here. Good. And now what I'm going to do is I'm going to do a real light palpation of the abdomen. And then follow up with a deep palpation of the abdomen. We're going to be looking for any masses or tenderness or discomfort while we're doing the exam. Feel for the spleen back here on the right side. Go ahead and bend your knees a little bit for me. It might be a little easier for you. Deep breath in and all the way out. Good. Same thing over here. Deep breath in, all the way out. Okay. Now you go for the liver. Okay, one more time in. Deep breath in. Pull it all the way out. Nice and relaxed for me. Perfecto. Last time. Deep breath in and out. Good job. All right. I'm going to have you sit up here for me. And we're going to check for costovertebral tenderness. Bilateral posterior back here. Any tenderness when I'm doing this?
No.
Good. All right. Now we're going to check the respiratory exam. Respiratory exam, we're going to start off basically looking for any nasal retractions or difficulty breathing as we're doing the exam, any tripod positioning, any nasal retractions or cyanosis of the fingers. Also, maybe take your shoes and socks off for this exam too.
Okay.
You get them off easy then?
Yeah.
Aren't you glad you washed your feet last night?
Wow, you caught me in my running shoes.
All right. So first we're gonna look at the. Bring your head up for me. Just looking at trachea for central line and midline. Go ahead and swallow for me. Good. Relax. Go ahead and take this sweater, top sweater off. It might be a little easier for us today. And first we're going to start off looking at the back, and ideally in this position the patient will be robed so we can get a good look at the skin, but since that's not the case for today with a webcam video, we're just going to go ahead and focus on the patient and tell us that we would look for any symmetry in the posterior spine. We're going to look for any changes in color, any scars, any lesions, any bruising, and again symmetry and alignment bilateral. And after we do that, we're going to check and do chest expansion. And I want you, let's just do this stand up so I can the camera see us. Face this way over here. Oh, right here. And turn around for me. So I'm just going to put my hands on her back. I want you to take in a deep breath for me. And all the way up. Just looking for bilateral equal chest expansion. Now I'm going to have you, every time I touch your back, I want you to say the words 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and now we're going to percuss the posterior lung fields. All the way down to the lower and lateral portions of the lung. Good. Now I'm going to auscultate the lung sounds. I just want you to do here for me is taking a deep breath, okay? All the way out. Good. Deep breath in. Almost done. Okay, now this time I'm going to have it followed by egophony, and I'm going to get that up again. There it goes. All right, I want you to start off by saying the words E every time I touch your back, okay?
E.
A little bit longer, E.
E.
Good.
E. 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 E.
Good. Now we're also going to follow that up with bronchophony, egophony. The whisper back row clue would only be if I found an abnormal finding with the E or the 99 from the bronchophony or the egophony. Okay, so have a seat back up here, please. And now I'm going to go ahead and look at the anterior chest, and the same thing, and be looking at the skin for any contours, changes, any asymmetry, any color of misalignments, cyanosis of the anywhere the chest or the extremities. I'm going to look for bruising, any scars or any lesions. And I'm going to first auscultate the chest by doing chest expansion first. So I'll put my hands on our lower lungs and taking a deep breath, please. And all the way out. Good. You're looking for equal symmetrical chest rise. Next, we're going to go ahead and do the same thing. Put my palm on each lung field and have the patient say 99.
99, 99, 99, 99.
Two more.
99, 99,
And then lateral.
99, 99.
Good job. Okay. Same thing here. We're going to listen with auscultation to the lung sounds. Taking a deep breath, please. All the way out. Good, and two more. You beat me. One more time. There you go. Alright, so now we're going to go and look at the cardiovascular exam, starting off with the carotid pulse. I just want you to relax. Do one side at a time. Next, we're going to go ahead and do the carotid pulse using the bellows stethoscope. Listen for any bruits. Okay. I'm going to go ahead and auscultate all five quadrants of the heart, starting with the aortic valve, second intercostal space on the right. Pulmonic, second on the left. Erb's point, fourth intercostal space on the left. Tricuspid, fifth intercostal space on the right. And we're doing the same thing over here. And it's actually maculavicular line for Erb's point. I'm sorry, mitral valve. And you also hand palpate the PMI for rate and rhythm. And I'll go through again using the Belda stethoscope for that exam. Now I want you to go ahead and lay on your back. And we're going to do the same thing pretty much over with the patient in supine positioning.
Oh.
You're fine.
Yeah.
Again with the aortic, pulmonic, Erb's point, tricuspid, and mitral. And also palpation for PMI, noting rate and rhythm. Also, we would elevate, which unfortunately we can't do in this bed, the bed to 30 to 45 degrees for jugular venous pressure, and monitor the pulse there too. But since we can't do that in this one, that's what we would perform next. We would also go ahead and do the abdominal exam again, just looking at the aorta, the renal arteries, iliac arteries, and femoral arteries. And then I'm going to check the fingertips for cyanosis, upper extremities, or capillary refill, I'm sorry. And same thing over here. And then we're going to check the lower extremities for capillary refill as well. Wonderful. All right, my dear, let's go ahead and sit you all the way up, please. Last one we're going to end up with is the musculoskeletal exam. Musculoskeletal, we're just going to be doing first initially palpation of all our extremities, noting for any swelling, any redness, any warmth, color changes, any bruising, or crepitus and symmetry in the joint. Starting off with the shoulders, coming down to the elbows, the wrists, and into the fingertips. Feeling hip joints, the knees, and the ankles, and lastly we're going to go ahead and palpate and inspect the toes. So now we're going to do some ranges of motion. I want you to start off just following me, okay? Bring your chin to your chest, look up to the ceiling, look all the way to your right and left.
Left and right.
That too. This way and this way. Okay, and then we're going to do the lower back too, but we'll do that when you're standing up. So let's go ahead and do the shoulders next. So the shoulders, I want you just to bring one arm over like this, back down, and the same thing up. Good. Your left arm, come all the way over. Aha, right arm. Simon says. Same thing over there. Good, and I want you to come around your back and come up as far as you can. And do the same thing with your right arm, please. Good. Flexion, flexion, extend. Now forward. And other arm. Good. And go ahead and stand up one time. This just might be easier. And for extension, we're just going to go ahead and bring your arm backward like that. Same thing over there. A little bit slower. You still good there? Okay. Come back up here, please. Now what I'd like to do is we're going to check the elbow range of motion. So bring your arms all the way out. Bring your arms all the way up. Hands down like this. Bring your wrist in, sorry. Bring your wrist out like that. Good. Now bring them over. Now bring your wrist down to the floor, please. Now all the way up to the ceiling. Good. Now hands like this. And bring your fingers in. And bring them out. Okay. I'm actually going to pause this exam right now because I just remembered on the neurology exam I forgot a bunch of things. So heading back a few minutes to the neurology exam, and we're going to go ahead and start off with detent reflexes. We're going to do that with the biceps first. This one's a little bit easier. Good. Tricep here, just relax. And triceps over here, just relax. Break your radialis now. Patellar, just relax your leg. Achilles. Good. And lastly, Babinski. Okay, now we're going to do light touch of the face and upper and lower extremities. Put your hands flat like this. Keep your eyes closed. Why don't you tell me if you can feel this here, okay?
Yes, I can
Does it feel the same on this side?
Yes.
And how about over here and over here?
Yes.
Good. Middle finger here.
Yes.
Okay. Lower extremities. Can you feel that there?
Yes.
And can you feel it here?
Yes.
How about here and here?
Yes.
Good. And then down here and down here.
Yes.
Awesome. All right. So where am I at here? Light touch. Okay, now we're going to go ahead and do cerebellar function test. I want you to tell me what this, close your eyes. This is stereogenesis. I want you to close your eyes and tell me what this is.
Okay.
I'm supposed to look at it. All right, can you keep your eyes closed, please? Tell me what number this is.
1.
Good. And now we're going to go ahead and look at me. I want you to touch my finger with your eyes closed. Just kidding. Just look up here, touch my finger, and then touch your nose. Good. Same thing over here. And lastly over here. Good job. Keep your hands flat on your lap. And one hand over. And just rotate back and forth. Good. Now last one. Eyes closed. Tell me what finger or what position your finger is in.
Running to left.
Okay. Good. Relax. All right. That was cerebellar function. Now I want to do Romberg's test. I want you to go ahead and stand up for me, please. And I want you to just face me. Close your eyes. And we're going to look for any swaying, any movement side to side for approximately 30 seconds. And we'll go ahead and let you step there. Since we analyzed, you can open your eyes. Since we observe your gait walk in the room, we're not going to do that since we're in a small room, but we're going to have her do heel to toe. Come back here. And I want you to walk heel to toe all the way to that door, and then go ahead. And turn around, please, and come back. Good job. Now face me again. And just one time, I want you to stand on your right leg and just hop one time for me. Good job. Relax your legs and do the same thing on your left leg, please. Good. Hop back up here on the table. You didn't fall. Good job. Okay, so now we're going to go back into the future and we're going to finish the musculoskeletal exam. We just did the ranges of motion of the wrist. Now we're going to do the fingers. So back to the musculoskeletal exam, starting now with the fingers for range of motion. Once you have your hands like this, close your fingers, open your fingers. Good. Bring your hands back like that. Hands forward, close them tight. Perfect. And we're going to go and do ranges of motion of, stand up please, of the hip joint first. I want you to bring your leg out and this leg out. Now the same right leg, I want you to bring it all the way across your legs. Perfect. Back in. And now all the way out this way. Good. Can you keep your leg straight and bring your leg in a circumduction circle motion? Okay, stop. And do the same thing with the other leg. Good. Right leg, I want you to bring your knee all the way up. Back down. And left leg. Okay, stand straight. Right leg, I want you to bring backwards. Okay, and now left leg, please. Good. Awesome. Have a seat again. Now we're going to go all the way down to the knee joints. I want you to bring your knee all the way out. And all the way back in. Same thing with your left leg, please. And down. Now your ankle, I want you to point your left toe, you can do them both at the same time, towards the floor. Up to the ceiling. Keep it flat now. And then bring the inside of your foot like this in. Good. And now out the opposite direction. Perfecto. Now we're going to go ahead and do those ranges of motion of all the extremities. And we're going to go ahead now and test for muscle strength of all the same dermatome levels. So we're going to start off using shoulder abduction. I'm going to bring your arms up like this, hold real hard as I push up, down. Now bring your arms down to your side, please. Good job. Arms like this, pull towards you, push towards me. Biceps and triceps muscle test, push towards you, and push towards me. Good. Stand up again. And left leg, I want you to bring out, please.
Up, that way.
Yep. Good. And towards you. Good. All the way out with this leg. And all the way in. Good job. Pop back up here, my dear. Almost done here. I'd like you to go ahead and do, now we're gonna do the knee flexion. Pull your knee into the table, or your leg into the table. Push against me. Good job, same thing here. Push towards you, now towards me. Now I want you to push your toes up to the ceiling and back down to the floor. Toes to the ceiling and back down to the floor. All right, so we have done everything except for, again, I forgot one more segment in the neurology exam, which is actually vibration sense.
Okay.
And here it is. Vibration, we're just going to put the vibration on the ulnar tubercle. Ulnar prominence, I'm sorry. Do you feel that?
Mm-hmm.
And we're going to do it here too. And I'm also going to put this on the medial malleoli. Can you feel both these?
Mm-hmm.
Good. And the last pulses we're going to do are just the radial pulse, the dorsal pedis, and the posterior tibial. And that includes our exam for the head to toe assessment.